Hi guys, good afternoon. Sorry about the time miscommunication. That was on me. Dee had other obligations, and I forgot that the time was different. So, anyways, thanks for joining us. This is Dee. She's going to talk to us about home health care. Hi, Dee.
Hi.
We've done this with Dee once before, and our communication connection wasn't great. She was in between home visits, so it didn't work out. We had lots of interest, so we thought we'd try this again. So, Dee, tell us how long you've been in home health care.
I've been in home health care since 1997 at the advent of handheld computer charting.
Wow. And so was that your very first job in nursing, or what did you do
No,
prior?
I had been in long-term care prior to that, and a good friend of mine who I went through cancer treatment with talked me into coming to home health.
Okay, wow. So, you did long-term care prior. How did that avenue prepare you for home health care?
Well, geriatric population disease processes were about the same. And but the people at home that I have now, most of them are less into the Alzheimer's phase than the ones that I was taking care of at that time.
Sure. Do you feel like home health care is a good place for a new grad to start out?
Well, our administrator is got a program that she has started with new grads
Okay.
to foster them along, and that's part of my job is to walk side by side with the new grads and train them to home health.
And
And
how's
it
that
seems to be
process going?
working.
Nice. Nice. Any pros and cons that you see with new grads versus experience?
Well, the autonomy of being out there on your own is very scary, especially
Okay.
for the new grad. There's times, I've been in this since, like I said, the 90s, and it's scary at times, even for myself. But just knowing that you've got backup just a phone call away, whether it be your office, another nurse, or 911 if needed.
Okay. Yeah. So, what advice do you have for nursing students who are interested in home health care or any nurse really that would make them a good nurse?
Um, Loving the geriatric population, 98% of the population is 65 or older. We're basically running in about the age of 80 right now. My
Okay.
oldest patient I've ever had in home health was 106.
Oh my
My
goodness.
youngest, unfortunately, was 32.
Okay.
And that one I had to flip her to hospice.
Oh, that's unfortunate. Okay, so how is the experience in home health, and do you have any insight or advice?
The advice is to be a very organized person, very time controlled. If you put off, well, I can do this little bit at home and I can do that little bit at home, pretty soon you're up all night charting.
Mm,
I have a saying, what you don't get done in the home, you go around the corner under your favorite shade tree and complete. When you go home, that's your time, not work time.
oh, that's really good advice. I like that. So let me read this next question. Oh, have you taken or do you plan to take any certifications for your specialty?
No, not at this time. I was going to in hospice, but I lost my husband suddenly. And so that got me out of hospice. It was just a little too hard.
Okay, I'm sorry to hear that, Dee. So
It's quite okay. He went very fast the way he wanted to go.
that's good to hear. I mean, fast is better. I agree. So those of you that are viewing, thank you for viewing. If you have questions for Dee about home health care, please feel free to enter them and I will read them as they fit in with our conversation here. So tell us about your three top challenges and how you overcome those or overcame those in the past.
Top challenges number one, whether it's long term care, hospitals, or home health, it's the families, not the patient. It's the usual. Getting past that barricade or barrier of the families of what they expect and what they want
Challenges and how you
being two different
overcome those
things.
or over.
Um, the patients, they're ready. Most of them, excuse me, most of them are ready for the care and the education. It's just, let's say they've come out of the hospital, and everybody knows when a patient's being discharged from the hospital, the information that they're given basically goes in one ear and out the other, and
Right.
family hears what they want to hear. They say, oh, the nurse is going to be out there 7 days a week and they're going to clean your house and they're going to do your laundry. You know, it's like, no, this is not nursing. Or they'll be there forever. Home health is not a forever thing.
Mm-hmm.
We work in 60-day units of working with the patients. Most patients are on for 2 certification periods, 120 days. But a lot of times it's still hard to get them ready to go off services. Things will happen, falls, injuries. You know, you're treating a patient for a hip, let's say, and they've got a long-term underlying of asthma, COPD, and then you get exacerbations in there. So you've got changing conditions, and your focus of care changes, and your time changes.
Mm-hmm.
We have really good programs for, there's 6 penalty diagnoses that if a patient goes back in the hospital too soon, Medicare will penalize the agencies. And we've got programs for cardiac, respiratory, hypertension, things like that. And we tell the patients and families, give us 30 days and see the difference in your life. And we're in the infant stages of this, and it's working very good. Our recidivism has gone down like 4% in 1 month.
Wow,
good
for you guys. Yeah. So we have a question that says, what are your hours like? Are they similar to 12-hour hospital shifts?
Nope, they're better. It's like I have to be available Monday through Friday, 8 to 5. All of our staff does that. We have a night on-call nurse, and we have the weekend on-call nurses. The night on-call nurse basically takes phone calls, triages. The weekend on-call nurses, we call them bailers because they bail us out. They work like 3 days a week, 10-hour shifts, and they see so many admits during the weekend. And that really helps our nurses to be home and have their family time.
Okay. Are your hours flexible?
Very flexible. It's like right now, I'm taking time off from work to do this.
Okay. That's great. Another comment came in. I'm a dialysis nurse considering home hemodialysis. Do you have any feedback or thoughts for her?
I have overlapped with home hemodialysis nursing, and I've seen such a wonderful, the patient stays better longer with the home hemodialysis. They're in their home environment. Their family can be around them. The patient, as she knows, has to go there 3 days a week, you know, hour upon hour upon hour. It interrupts their life. And having the dialysis nurse come into the home makes a big difference in the family and the patient's condition. Be around them. The patient, as she knows, has to go there 3 days a week, you know, hour upon hour upon hour.
Okay. Oh, are you still there? Okay, good. Someone says there's a lot of echo and feedback. Whose end is it on? My end or Dee's end?
Your end.
My end has echo. Okay. I might be too loud. Is that better?
Yes.
Great. Okay. Thank you for telling me. That's helpful. Okay. So let's see. Your biggest challenge, I think you already addressed that, being
the families.
And the families. Yes. So how do you keep yourself safe in patients' homes?
That has very rarely come up. I've been doing this since '97, and I've only had a safety issue one time. And I shouldn't have had the safety issue. It's just that 2 other nurses had safety issues with that patient, and they never passed it up the line to me.
Oh, wow.
And it was the patient not allowing the female nurses to leave the home.
Oh.
Yeah. A little persuader in the pocket, and showed him the handle of it, and he let me out.
Wow. Okay, so I'm getting feedback from the viewers that they're getting echoing on your end.
Okay.
Do you have a volume control on your mic? It's your phone, isn't it?
It's my phone, yes.
Okay. Sorry, guys. We're not going to be able to do anything about that. Maybe you can turn the volume down on the side of your phone, Dee. That might help.
I did.
Okay, great. Let us know if that helps, guys. Okay, so best advice for a nursing student interested in home health. I think that's a repeat.
When they do their community nursing, go to their director of their program and ask for home health. because there's different community-based nursing programs, whether it be an outpatient program, school nursing, or home health.
Okay.
Company I was with prior to here, when I lived in Texas, we worked a lot with the nursing students.
That's great.
And they would go out with myself because I was the preceptor, and I would do the visits. And I love doing it because I love open minds to learning.
That's great. I enjoyed my one day that I got to shadow a home health care nurse in nursing school. It was fun. So if you were speaking to a seasoned nurse about reasons they should transfer to home health care, what are your top 3?
Family time. When you're off, you're off. My computer does not go with me if I'm not working. I make sure all my charting is done. I know I've got a very good company behind me that backs me up, and I've got good staff that's going to be there for follow-up and on-call.
That's good. So what are the characteristics? You mentioned organization. Anything else that makes a successful home health care nurse?
Time control. That is the main thing. If you can keep yourself on task, you've got it. It's the people that put off things, or they don't allow enough time. It's like, okay, I've got 6 patients to see today, and I'm going to see this patient back to back. They don't take into consideration travel time. There's many rural areas. I came from one area where we just had patients that were 50 to 70 miles apart.
Wow.
You don't see those patients on the same day. It's, management of your time.
Yeah, absolutely. A question just came in. How much experience should I get before embarking into home health care?
Like I said, our company has a program with new grads. You come in, what our administrator says, new grads come in with no bad habits, and we can train them. It's really hard being the preceptor, and you get, at my previous company this, and at my previous company that. Why are you not with that previous company? We like clean slates, and if you can manage your time, home health can be a great thing for you.
Another question.
The wonderful thing is the one-on-one care with your patient. You don't have call lights of 4 other patients wanting your attention at the same time.
Absolutely. I can definitely see the perk in that. Another question came through. Do you have on-call times on holidays, and is the pay comparable to inpatient nursing?
Actually, it's better.
Yeah.
Our pay is much better. There's a national average, and our company is above that. And they do have nurses that will take the holiday on call. They'll go, if we have a patient that's daily wound care, let's say, they want that extra money, they'll go up there and they will see those patients.
Yeah, absolutely.
I will be picking up on call about once a month myself, just for extra money and something to do.
So it's an option in your current state?
Yes.
That's great. Okay, so what does the typical day look like for you?
As the preceptor, I don't have a typical day. My day depends on what is needed. My job is to train new nurses, fine-tune nurses, and also do our general education, where we have monthly all-staff meetings. I'll be doing the education on those.
Oh, great.
Medicare sets out guidelines that so many things have got to be done each calendar year, and it's your CEUs that you have to get through the company, along with your other ones that your state requires. And I'll be teaching those classes also.
Awesome. So what's a standard home health care nurse is when you were not in a precepting role? What does a typical day look like?
About 6 patients a day, depending on what the needs are. We have different graduation of care. We've got a routine visit, which is like a 30-minute visit of a quick head-to-toe assessment, checking their meds and seeing what's going on. Then you have your patients that'll take about 45 minutes. Those could include wound care or Foley catheter changes. Then you have what we call a recertification. At the end of 55 days, the RN goes in and goes through the chart and reviews, what does the patient still need from us? What are these skills? We have to have a global skill to see the patient. And recertifying for those. That visit can take an hour to hour and a half. And then we have our admissions. that can take 2+ hours because of all the inputs into the computer. And even though it's an admit, you still have to have a billable skill on that first visit. You can't go in just to admit the patient.
Okay.
We try to get 6 points a day. Everything's got its own point value. Routine visit is 1 point. Research is like 1.5 points, and an admission is 2 points.
Okay. I see. So it just depends. Sometimes you're going to see 6. Sometimes you're going to see a few more, a few less.
Right. There's times you'll see like 2 admits and your day's done.
Nice. So I've heard nurses hesitate going into home health care because they think they will lose their skills. What are your thoughts?
No, we do everything from soup to nuts. We do wound care, wound vacs. We work with patients on home IVs. We do Pluravax. You name it, we do it. You get a broader base of skills in home health.
And if you've never done a wound vac per se, let's give that as an example. You as the preceptor, when your nurse knows that they're going out to do a wound vac change, do you just accompany them to that visit?
We have a thing is see one, do one, doc one.
Okay.
So the first one, you go out and you see it happen.
Mm-hmm.
You're just a bystander. The second one, you go out and you do it. And then you do the documentation there with me present. And then the third one, you go out the visit on your own and you do it. And then your documentation. And then I would be checking the documentation at night.
Nice.
Or the next morning.
Okay, great.
And if the nurse has any problems, they can call at any time. Okay, I've got an air leak. What do you suggest, on this or that?
Mm-hmm. That's great. So what's your favorite tip or trick for home health care?
I'm sorry?
Your favorite tip or trick for home health care?
Be personable with your families and listen. If listening to them, sometimes we're the only outside from the community that they have. They're a widow or a widower. All their children are busy with their own lives and they're lonely. They want somebody to listen to them, somebody to talk to them. And if you're able to really listen to a patient, you can learn everything about them and what their needs are.
Yeah. Another question's come in. In inpatient, there is always another nurse to help troubleshoot a difficult line or tube, etc. How available is another nurse if you can't start the IV or get the tube in?
Okay, we have the patient just last 24 hours. 3 nurses have tried IVs on this lady. We can't get her. She's got concrete valves and she will tense up. So, we're going to send her to a lab on that. The IV tubing, we use, I'm old school. We use what we call a cue ball. It's a white pressurized ball with the medicine in it. And you don't have the pumps beeping and everything. And it's basically the ball is pushing the tubing through, or the medication through the tubing. So you really don't have those beeping monitors.
And what about like a Foley or a G tube that you're replacing and you can't get it back in?
Another nurse is a phone call away. Most of our office staff are nurses also.
Okay. And so will they just come out and meet you there if you're trying and can't seem to meet? Awesome. Yeah. So you've got good teamwork. That's great. So what do you love most about your specialty? You've touched on
autonomy, being on my own. I love being out in the field, of not being in the office all the time. I love the office, don't get me wrong, but being able to, between patients, think about what I just did at that last patient, think everything through. Or I've got this difficult patient I'm heading to. I can think about them as I'm going to my next visit, which really helps in getting what I need done.
Mm-hmm. Nice. And what's the hardest part of your job?
Traffic. I'm in a high retirement area here in Florida called the Villages, and top speed limit is 35.
Oh my goodness.
It doesn't work. There's golf carts everywhere. This is a golf cart community, and people don't drive to the store in their car. They take their golf carts, and those things go pretty slow.
That's funny. So you've been in home health care since 97, right?
Yes.
Is there anywhere in nursing that you would like to try that you haven't already tried? Not that you're going to hop off and leave today, but is there anything that you would like to try that you haven't tried?
If I left here, I would go back to oncology.
Okay.
I loved oncology. Saturday will be 33-year cancer survivor.
Oh, goodness. That is amazing.
And for somebody that was given 6 months and be at the 33-year point, to be able to help other people. We get patients that are going through chemo in home health also. Mm-hmm. And to be able to help them, really passing it on.
Yeah, absolutely. I love that. Okay, so what is the biggest change you've seen in your however many years that total since 1994 is when you started, right? 1994. Yeah. Okay, so since 1994, what is the biggest medical advancement that you've seen in your career?
What we're using right now, the webcam. I was instrumental in the beginning of webcam when I was in Oklahoma in the beginning stages of home health. We had a lot of wound care patients that were extremely rural, that were truly homebound, had no car to get to the doctor. We had a family give us a very large grant. And Oklahoma University technology department developed the webcam, which looked like a gigantic ball that we would hold in our hand. We'd hook to the phone. We'd have to hold the ball and hold a ruler to the wound, to send back to the doctor, to having it down to this tiny little dot on our phone now.
Right. That's pretty phenomenal.
It is.
Do you guys utilize...
Being in the first of electronic medical records, EMARs, having the first ones look like the great big Texas Instrument calculators. They were fun, but they were not practical because you'd put in, like, I used 3 4x4s. You'd go back to the office and you'd have a flag on your chart. Why did you use 3 gross?
Oh, that's funny.
4x4s. So going in and correcting at that time was really bad. Now the corrections are just minimal once you get the systems down, and it's a lot easier. And just seeing everything to where OASIS, which is an admission packet, would be 48 pages long, to where it's all on. I could do it all on my phone now.
Wow. That's pretty phenomenal.
It is.
Do you ever use the webcams to communicate with providers in the field regarding your patients currently? I
have, yes.
Okay.
Doctors will say, well, send me a picture of that right now. Or can you show me a video of, what, and I write to their cell phone.
Wow, that's great. That's really great. Does anyone else have any questions for Dee before we end our question and answer session? Oh, I feel like I'm going to sneeze, so pardon me if I do. It'll be super loud. All right, Dee. Well, it was super informative. If other people have questions, you guys just leave them in the comments. And when Dee sees those comments come through, she can answer you after the broadcast is over. You guys have a phenomenal day. Thanks for giving us your time, Dee. I appreciate it. Oh.
Bye-bye.
Bye.